RAND, the Asia Pacific continues to be a region of focus. RAND has worked in almost every country in the region, from Afghanistan to Australia, from Mongolia to Indonesia.
The leadership of Guangdong province, it's a province of 120 million people, asked RAND to develop a system of quality of life indicators and to recommend a set of strategies to improve quality of life. It's bringing in virtually every area of public policy.
The Chinese government is aware that cleaning up China's air may cost a significant amount. However, that cost has never been quantified. Our study found that the cost of 3 key air pollution control policies in China will aggregate to less than a third of the cost of pollution in China.
Indonesia has the world's largest program for community-driven development. We went to poor neighborhoods in cities across Indonesia to learn how well the program was working. The RAND study findings helped the government of Indonesia improve the effectiveness of a program reaching millions of poor families.
School-based management moves the responsibility of school operations from central authority down to the school level. The RAND team provided actionable ways to undertake the reform, as well as strategies to reduce resource disparities among schools. The hope here is that the education system will become more responsive to parents' demands for a quality education for their children.
Like many Asian megacities, Ho Chi Minh City faces significant flood risk. At the request of the World Bank, RAND worked with Ho Chi Minh City to develop an integrated flood risk management plan. Arriving at such a plan is a challenge because there are stakeholders with differing interests and differing expectations about how serious the risk is going to be. Because science can't tell us what's going to happen in the future, we used a technique called robust decision-making. This approach allowed us to stress test the city's plans over thousands of plausible futures and identify ones that perform well over a wide range of future risk.
Women are at particular risk for depression in developing countries such as Vietnam. Poverty increases the risk for depression and vice versa, creating a downward vicious cycle. Microfinance is widely used for poverty alleviation, but it hasn't really been applied towards health problems. We tied depression care into microfinance loans and livelihood support. This is a way of repackaging depression care. The women are benefiting economically as well as emotionally.
To each of these projects, RAND brings a multidisciplinary approach and vast prior experience. Our clients also welcome our preference for working with local partners, as this builds capacity and improves outcomes. The Center for Asia-Pacific Policy is RAND's window into the region, supported by its dedicated advisory board, all of RAND's capabilities, and our commitment to the region.